Why are diagnosis and early intervention so important?
Early diagnosis is important. Early diagnosis leads to better management. We looked at our own database, and there was another study from Ireland where they looked at patients who came within a few months of diagnosis and who came in later. So we could see that patients who came in early to the clinic, in our own clinic, we looked at patients who came in within 2 years of diagnosis. They did much better than people who came in late. In Ireland, when they looked at the study, what they found was that patients, even a delay of about 6 months, made a big difference in the long-term outcomes. So we believe that if there are signs and symptoms, it's best that the diagnosis is made within the first 6 months and treated appropriately so that future damage and disability is prevented. And so the diagnosis becomes important. It's also important because a lot of the symptoms of psoriatic arthritis is non-specific. So in the general population, joint pain is common, back pain is common, heel and other enthesial pain is common. So the crucial question is that what if a patient with psoriasis has back pain or a heel pain? Is it just just because there's no relation to the psoriasis, it's just mechanical, or is it actually inflammatory arthritis? And so that's where a rheumatologist needs to evaluate and do appropriate investigations, for proper clinical exam first. Blood work from inflammation is generally not very useful because the blood work is usually normal, and sometimes you need further imaging, ultrasound, MRIs and X-rays to figure out if there is actually inflammation, then treat it appropriately. So because if it's inflamed, then it's important to get the inflammation down. If it is not inflamed and if it's mechanical, then there are other measures that is usually appropriate to keep it to improve the pain and quality of life. So that, because the treatment really depends on if there is significant inflammation, it's important to make the diagnosis by a rheumatologist is the person, the specialist who can do that. And one of the reasons is the lack of biomarkers. In diseases of rheumatoid arthritis, you have rheumatoid factor, you have anti-CCP, usually the ESR and CRP is elevated, whereas in psoriatic arthritis, there are no the CRP and other markers of inflammation that we generally do in the clinic for the general population. They are not really very different from normal people, and then there's no markers like rheumatoid factor. So there's no diagnostic test that a family doctor could do or a dermatologist could do, and that's why it's important to see a rheumatologist to make that diagnosis.